Hello, everyone. Welcome to another episode of Chat with the Editor. My name is Maxwell, Assistant Editor of Social Media, AJNR, and I'm excited here to be joined by Dr. Gloria Chiang, Associate Professor of Radiology, Weill Cornell Medicine. It's an honor to have you here, Dr. Chiang. I'm excited to have you.
Thanks, Maxwell. Nice to meet you.
Nice to meet you too. Can you tell us about your background, and your whole trajectory to radiology?
Sure. I had a bit of a circuitous route to neuroradiology. So I went to undergrad at Princeton, and I was always a math and science kid growing up. But I remember when I went to college, I was pretty intent on exploring different things. And I ended up taking a microeconomics course with Uwe Reinhardt, who was a world-renowned healthcare economist. And I love the ability of economics to use large data to sort of answer questions about the world around us. And I ended up majoring actually in econ, thinking that I was going to go into a career of health policy. And actually, all the statistical methods and regression models that I still use every day in my grants and papers were from my time as an undergrad. As time went on, I had some friends in undergrad who had some medical issues, and I decided that I didn't want to just create sort of large blanket policies, but I actually wanted to be boots on the ground, taking care of people. And so I ended up going to medical school at Harvard. When I was there, I knew I'd always had a fascination with the brain. And so I knew I was going to do something neuro related. So either neurosurgery or neurology or neuroradiology. And my first clerkship was actually surgery, which I loved. And as part of my mini elective, as part of that rotation, I remember scrubbing with Bob Carter, who I think is now chair of neurosurgery at MGH. And he was just a great guy. We talk about my career aspirations. And at the time, really, neuroradiology, interventional neuroradiology was really taking off. And he said, Gloria, go into neuroradiology. And later on, I worked with Deborah Levine, who's this fetal brain MRI guru. And I'd spend hours on the weekends looking at the fetal cerebellum. And I realized that I could spend hours looking at these beautiful MRIs of brain structures. And then I worked with John Chen, who's a guru in molecular neuroimaging. And so that sort of sealed my fate into neuroradiology. And, I've been attending now for 12 years. So I did my residency and fellowship at UCSF, and I came to Cornell here as an attending. And every week I'm still seeing fascinating cases. I'm still learning a lot of new things, and so I think it was the right choice for me.
That's great. Thank you very much. What's your role as an editor in AJNR?
So I'm a senior editor focused on neurodegenerative diseases. And so I work very closely with Priya Rajagopalin and Dr. Priya Rajagopalin and Dr. Frank Yu. And we receive the papers that are focused on imaging of neurodegenerative diseases. And, I would say, it's sort of interesting because when I first started as an attending, frankly, no one really cared about imaging dementia or imaging Alzheimer's disease because there was no treatment and there was no, real good ways to manage these people. And so a lot of my colleagues would say, oh, well, it's just an atrophic brain, what's so interesting about that? But in the last few years, I would say imaging of neurodegenerative diseases has changed dramatically, especially imaging of Alzheimer's disease. We now have anti-amyloid therapies. So for the first time, we have a disease-modifying therapy. We now can get amyloid PET scans clinically that are reimbursed. And so imaging has just exploded in this realm. There's a lot of interest now in developing new ways to diagnose the disease. We also play a major role in monitoring for ARIA, these amyloid-related imaging abnormalities, for people who are on these monoclonal antibodies. And so things have changed dramatically in this field in the last few years. And so it's been very exciting to be part of it.
All right, thank you very much. As an editor, what are some of the problems you usually encounter or you find when you are reading articles? What really stands out for you when you're looking at scientific articles, and usually what problems do you find?
Yeah, so I would say that I remember someone telling me that you know some of the most successful researchers in medicine actually had a background in the humanities. And I always thought that was sort of funny because people sort of assume that you have to major in biology to go into medicine. But I think that's quite true because writing is so important, I would say, in research, especially very clear, concise writing. And, I tell this to my trainees as well. When you're writing a scientific paper, you don't want your reader to have to struggle with it. You don't want them to have to figure out what you're trying to say. You don't want to create terms, you don't want to create new terminology that could be confusing. So I would say really focusing on clear writing, consistent terminology, having someone proofread your article, even someone who's not in your field, just so they can at least give you a sense of what you're trying to talk about, I think is really important. And that's true for papers and grants. The other thing I've noticed is, I think in imaging, we all get very excited when there's some new technique that's being developed that people are starting to use. And oftentimes I see papers, these sort of small cohort studies with a new technique. For me, the significance of a new technique really has to show that it's an improvement upon what's already done as part of current standard of care. And so if there's a new technique that shows, let's say, I don't know, 80 to 90% accuracy, that's great. But if our current standard of care imaging already provides 80 to 90% accuracy, that's not as exciting, I would say. So I think it's important also when you are reporting new imaging methods to compare it to standard of care. And the last thing I would say is, I encourage everyone to really focus on statistics and statistical methods, and to really understand, what a p-value is, what regression model to use, because this can also really back up whatever you're trying to prove in your research. So I would say those are the main points. But yeah, definitely try to be as clear as possible in your writing, to make your reviewers happy so they don't have to struggle as they're reviewing it.
Okay, thank you very much for that. What's the best thing about your career so far? What has been the best thing about your career as a neuroradiologist?
So I think that it's very exciting still, I would say, after all these years, to be able to use the latest technology, the greatest imaging toys to sort of figure out how the brain works. I still think that's really fun. There's still so much we don't know about the brain. I like being in the academic environment. I've stayed in the academic environment because I like working with the best and the brightest in terms of our students and trainees. I think that it's easy to get caught in this grind of just reading tons and tons of cases every day. But when there's this, curious medical student in the room who still feels awe and wonder when they see sort of a 3D reconstruction of the carotid arteries, you get excited again too, because I think as an attending, we forget how exciting a lot of this technology is. And I love working with my colleagues. I love being in a reading room with them. We share interesting cases with each other. We get to collaborate with, top neurosurgeons, neurologists. And so I've really enjoyed it.
All right, thank you very much for that. So what's a typical day for you as a neuroradiologist / AJNR editor?
So I have a bit of a unique setup because I am an NIH funded investigator. I'm very fortunate to I received my fourth major NIH grant, and so um, I end up having basically one clinical day a week. I'm also vice chair of clinical and translational research here, so I oversee about 50 of our research faculty members. I also direct our Brain Health Imaging Institute. And so in addition to my own research, we follow about 500 some individuals across the Alzheimer's disease spectrum with multimodal MRI, PET. We do fluid biomarkers, neurocognitive assessments, looking at early changes in the brain that could be related to cognitive decline. And so I wear a lot of hats, I would say. And typical days for me, I spend most of my day either doing clinical work, responding to emails from our collaborators who ask me to look at scans, or back-to-back meetings. And, in the evenings, I go home, I spend time with my family. And then at nighttime, when my kids are asleep, I do most of my writing. So I need a lot of quiet time to actually write papers and grants. And for whatever reason, for me, it's 10 o'clock is when I do most of my writing when my kids are asleep. And so every day, it's fun because I get to do a lot of things. But it's a lot of sort of planning my hours to make everything fit.
Okay. Thank you very much. How do you maintain mental awareness as a doctor in general, neuroradiologist?
Yeah, mental health is so important. I have two kids. I have two sons. They're 10 and 13, and they are very into sports. And so a lot of my weekend time is spent taking them to basketball and lacrosse games. And I have to say, it's really fun to have something outside of work, whether it's your kids, whether it's a hobby, to just take your mind off of, academic, work-related things. And so I look forward to seeing them play basketball and lacrosse. It's always a lot of fun for me, and I spend a lot of time with the other parents, and we cheer them on. The other thing I do is I block off weeks at a time, I would say. So, for example, if I have a very intense period of grant writing that I know is coming up, I have a deadline to reach, I know I have several weeks where I really have to dig in and do a lot of writing. I plan little treats for myself. So I tell myself, okay, after that grant submitted, I'm going to go get a massage, or I'm going to go out with friends and go out to dinner. So I build in little incentives for myself to look forward to get me through those more difficult work periods. So yeah, but I think it's so important, I would say, to have other outlets that are outside of work, to keep yourself going.
Okay. So if you had not gone into medicine, what would you have done instead?
So I would have stayed in academia. Like I said, I love working with students and trainees. I like having the time to think and question things. So I'd probably stay in academia. Maybe I'd be an econ professor, something like that. I loved I loved studying econ at Princeton. So something like that.
Okay. So the last question, what advice will you give to future radiologists or neuroradiologists? Do you have any special advice for them?
I don't have any special advice, but I will say again that, we talk so much about burnout. And whenever I go to meetings, everyone's always talking about, dealing with super high case volumes, these never-ending lists of cases to read. And it's really easy to get just stuck in that grind every day. So I would say to, future radiologist trainees, really have something that you can hold on to that can make you happy at the end of the day. Whether it's, a new thing you're going to bake for yourself, a new place that you're going to hang out with your friends, something fun to really treat yourself when work gets really hectic. And, even when I think back to my own residency, the tendings that I knew that seemed the happiest were the ones that did a lot of different things. So they weren't just the ones that kind of were just doing clinical work, but they still had that intellectual curiosity to pursue research. They enjoyed meeting people at conferences. They had interesting hobbies outside of work. So I think it's important to just have different things in your life to keep things fresh and fun.
Okay. Thank you very much. Do you have any special radiology sign?
Yeah, so I mentioned I don't have a favorite radiology sign. I do have a favorite structure, which I told my trainees. I love the word obex for some reason. It's such a succinct word. But so for people who don't know, the obex is the opening to the central canal of the spinal cord. And for some reason, I just think that word is hilarious. And, there's all this exciting work now being done with CSF dynamics, and there's so much focus on the brain. But I think that probing this sort of CSF flow into the spinal cord is going to be meaningful in the future. So anyway, that's my favorite anatomical structure, even though it's not a radiology sign.
Thank you very much. It was an amazing time with you, Dr. Chiang. Thanks for joining me.
Thanks so much, Maxwell.